Thank you for joining us. Welcome to a special edition of Your Health. Now, we found ourselves in very interesting times right now, and so we have performed a few Zoom interviews that we thought were important to share with you on our Your Health program. The first one we have is with Dr. Mark Taub, who is with MemorialCare Saddleback Medical Center. He's the emergency room director, and he wanted to share some interesting things with you about the emergency room and how they've separated COVID-19 patients with regular patients. And then we also have a segment from Dr. Hovanessian, who is with Harvard Eye. Enjoy the special edition and stay tuned. Welcome back. Well, today I am joined by Dr. Mark Taub, and he is with MemorialCare Saddleback Medical Center in the emergency room. Well, Dr. Taub, thank you so much. I really do appreciate you joining us today.
Well, thanks for having me back. I appreciate it.
And here you're coming straight from the ER room. Tell us a little bit about how things are sort of set up now.
Okay. Well, I'm talking to you from MemorialCare Saddleback Emergency Department, which is right here in Laguna Woods. And we're actually talking right now through one of the cameras and systems that we use to allow outside physicians to actually speak with patients here in the emergency department.
Okay. All right. Yeah. Well, teleconferencing and telehealth seems to be sort of on the rise right now, given our circumstances. Are you guys finding it necessary?
Well, we are, and there's many situations, for instance, with the current COVID crisis, that physicians can't make it to the emergency department for any reason. Right. So this helps us get rapid consults, for instance, neurologists, orthopedists, other geriatric specialists. Mm-hmm. And it also helps us for patients who are very ill with COVID virus, that physicians can speak with them without actually going in the room. So we can talk just like we are right now. And it's been a really helpful part of the response, not only here, but across the country.
Let's talk a little bit about some of what you're seeing right now. Obviously, this could be the surge right now. Are you seeing patients now with COVID-19?
Yeah, so good question. So right now, looking at current prediction models, they feel this week for California is probably when the big surge is going to come, if it does come. Right. We're not seeing massive numbers right now. So for instance, we're not seeing what Los Angeles is seeing. We're not seeing what New York is seeing and other parts of the world and country. So we're so fortunate right now we're not seeing those numbers. But I do want to let people know we are seeing plenty of patients with COVID disease. So it's a very real threat to all of us right now. So that's where we're at right now. And we have room to help anyone. We're not overrun with patients, and where doors are open and we're happy to help.
And, let's touch on that, because we are seeing that people are not wanting to go out because they're afraid or they're fearful of getting COVID-19. Yeah. Gosh, if somebody has chest pains or some other ailment, what would you suggest they do?
Yeah, so good question. So what I would say is, as much as you can right now, stay at home, social distancing, isolate, because that's what's helping us right now in our community here and why the numbers are so low in Laguna Woods. So keep doing that. Having said that, if you're at home and you feel that you might be having a heart attack, for instance, with chest pain, or a stroke, for instance, one side of your body not working, high fevers, confusion, maybe you fell, injured your hip, and you need to see a doctor, we're here 24/7, and we put systems in place to make sure that if you do come to the ER, you're not going to get exposed to COVID and get it when you wouldn't have otherwise. So we're keeping it as safe as possible, not only for our patients with COVID, but everyone else, because people still get heart attacks and strokes and all those other things. So we want people to not be afraid to come here if they need to.
So what could they expect? So let's say someone was they would call 911 just like they normally would if there was an emergency. Yeah. And then when they're brought in, what would they expect to see showing that separation?
Yeah, so I think that's probably helpful too, so it wouldn't be so frightening if you did come here. So the first thing I'd tell people, not everyone needs to come by 911. So if it's something not super serious, you feel stable to get here by private auto, and you can do that, still with social distancing, you can do that. We have plenty of parking, happy to help you through the front door. Okay. If you do need to call 911, which is totally appropriate if you're having a heart attack, stroke, confused, injured yourself, can't get up, then you'll want to let 911 know what happened to you. Okay. And you might be someone who maybe has COVID virus symptoms like fevers, chills, cough. So when you call 911, they're going to ask you about all that. So the paramedics can be prepared. Okay. The paramedics are all outfitted now in personal protective gear. So they'll have masks on. the gowns, gloves to protect you and them.
Mm-hmm.
And then when you get to the emergency department, what we do is now, whether you're coming to the front door or the paramedic door, we're going to have a nurse out front waiting to greet you.
Okay.
And we're going to ask you a series of questions, such as, do you have a fever? Do you have a cough? Do you have a cold? Things of that sort, to determine if you might have COVID virus or not.
Mm-hmm.
If you don't have any of those symptoms, for instance, you're coming in with a stroke and none of those symptoms, we will take you to one half of the emergency room, where it's all patients who have no symptoms whatsoever of coronavirus, and you'd be very safe there. If you do have symptoms of coronavirus, then we would take you a different half of the emergency department. So we're keeping all those patients separated so everyone gets great care, but also stays healthy. And also I'd point out too, every patient who comes in is wearing a mask, which is the number one protection for other patients. Yes. All of our staff members are wearing a mask. I should be wearing one now, but I'm in a private room away from everyone. But you'll see all the doctors and nurses are wearing masks. And if you are in the area where COVID-type patients are, you'll see all of us wearing even more specialized gear to protect us and to protect you.
Well, it's nice to know that you have the supplies that are needed. Are you guys well equipped?
You know, we are so well equipped. We're so lucky with MemorialCare, all of our hospitals. It's not like what you're hearing in other parts of the country, other parts of the world. We have everything we need, probably even being more safe for our patients than us. We just really want to do the best.
That's great. I mean, that's really good to know, because it's really heartbreaking when you see that people are making masks out of our regular types of materials and trying to ship them off. So, well, good. Well, hopefully the numbers will stay low in our areas so we won't have to worry too much about an influx.
Yeah, that's my hope. And I would point out, again, I said earlier how proud I am of Laguna Woods. I mean, according to yesterday's stats in Orange County Public Health, there were 7 cases for the whole community. Up until now. And that's happening because people are staying at home, they're social distancing, they're washing their hands, they're doing all the right things. So even though we haven't seen that massive surge, that could change really quickly if people let up right now. So I just really want all our citizens here to keep doing what you're doing, and we'll let you know when it's safe to resume, normal life. And that could take a while, but keep doing it. It's going well in this community.
Let's talk a little bit about some of the testing. I know you guys have testing available. Which testing is it, and when do you anticipate the new antibody testing?
Well, so the testing we do right now in the hospital, and just a little history, when it first started, it was really hard to get a test.
Right.
Testing times were taking up to a week or so. Now we have here in the emergency department, in our lab, we can test patients who are coming here, who are going to be hospitalized, or we're trying to decide if they have COVID or not. We can actually get results in as short as 15 minutes. So this is a test. It's based on looking for what's called RNA, which is the nucleic acid within the center of the virus. So it's a very specific test looking for that. So we can do very rapid testing all here in-house and very quickly, which helps us now make decisions that we couldn't have done even a week ago. So it's great. Now, as far as the antibody test, that's not something we're doing here yet. It's still new and they're working out the kinks on that, but that may be somewhere we'll be heading soon too.
Yeah, I know there's a lot of talk amongst, politicians and a variety of other government agencies that we're talking about rolling that out here in the next month or so, just to help us kind of get back to a normal, whatever that new normal looks like.
Yeah, and I think that's super important. I'm looking forward to that. I guess for us being at the ground level here, to actually have a test now that we can say yes or no within a positive test only takes about 5 minutes, a negative 15 minutes. I mean, that changes everything for us. Wow. So it's really helping us focus our resources now and just give better care. And when people come and they're worried about that, to get that immediate result and not have to go home and wait a week, it makes a huge difference. So I think this week is so different from last week.
Yeah. Well, gosh, things are just so ever changing, isn't it?
They are.
Crazy.
Yeah.
Well, good. I'm really glad you guys are super prepared and that you're not seeing the kind of crazy numbers that New York and some other places are seeing. When you and I spoke about a month or so ago, we were talking about some other services. You still have those services going on now, right?
Yeah, we do. I remember I was over at the studio just a month ago, and we were talking about the fact that we're Orange County's first certified geriatric emergency department. And we talked about all the services we have now for our hip fractures and our stroke patients and all the special things we put in place.
Right.
Again, that was a month ago. It feels like a whole new world now, but it's super important. I want people to understand, again, we've separated our emergency department. So if you are a senior with problems that have nothing to do with coronavirus. Again, hip fractures, strokes, heart attacks. We still have all that in place. We don't want to let go of that. So still know we are here to serve our community. We're a wonderful place if you're a senior to get emergency care. And we'll keep that. That's always going to be there.
Excellent. Well, that's really good information, and we don't want people to be afraid. And one thing I'd like to say to you and your staff is thank you so much for doing all of the things you guys are doing. I mean, we were certainly trying to stay home and just sort of minimize what we do because you guys are doing everything for us. So thank you.
Yeah, well, thank you. And I'll just echo what you're saying is I just want to thank all of our doctors, all of our nurses, all of our hospital staff, the people at all the other hospitals and the paramedics. I mean, they're literally putting their health on the line right now to help the community, and everyone's stepping up and doing our best job. And the good news is all the gear we have and the protective gear, we're really limiting the number of healthcare workers who've gotten sick. And it's just been great. And also the community, we've gotten so many donations of supplies and food and cards and things on social media. It really means a lot to us because when you work a 12-hour shift and you're in all the gear, it gets really hot and really tiring. Right. You'd be surprised the little messages we get from the community really mean a lot. It means a lot to me and warms our hearts. So keep all those messages coming. We appreciate it.
All right. Well, thank you so much for taking the time. I do appreciate it, and you stay healthy.
Thanks, and I look forward to talking to you when we're done with all of this and talk about some other items. Okay.
All right. Sounds good. Thank you again.
Thank you. Bye-bye. Thank you.
All right. And we'll be right back after this. Welcome back. Well, today I am joined by Dr. Hovanessian, and he is with Harvard Eye, and we have our Zoom thing going on. Well, welcome. How are you?
I love it. It's great to see you, Lisa. You look terrific for somebody in a pandemic.
Oh, well, so do you. So we're doing something right. Maybe we're not letting the whole fear and scariness of this affect us, because that certainly can be, something of concern. But nonetheless, what is it you are doing these days?
Well, on the personal front, I'm trying to keep active because I think that's important. And doing it, in these conditions is harder than normal because not all of our normal facilities are open. Right. But the outdoors is beautiful, and on most days we're having great weather, so I'm getting out and exercising. And thankfully I have my wife and my kids to do that with me. And so on a professional side, we are trying very hard to take care of all our patients because we're blessed to have so many, and we're doing that. And increasingly, we're doing that in new and novel ways, like video conferencing.
Right. Well, it's interesting. Like if I get really close, could you even see my eyes?
We ophthalmologists are used to our microscopes and our data and all of that, but it's actually amazing how much we can do by looking exactly as you just showed. I'm getting good at telling patients, okay, look up, okay, look right.
Oh my gosh,
feel the eyelid open. But and it's particularly important now because we're seeing a lot of people who are having difficulty with environmental stuff affecting their eyes. I don't mean entirely COVID, but people are worried about that. Does COVID affect the eye? And it can. And people are more commonly, though, suffering from allergies and dry eye, the two commonest ones we deal with here in Southern California.
Right. So would you say that obviously the allergies is an obvious situation, but the dry eye, let's talk about that. So people are looking at their computers a whole lot more.
Yeah. Great point. So screen time definitely drives dry eye symptoms because when we are watching a screen, we don't blink as often as we normally do. And so that means there's more drying of the surface of the eye. Our diets may not be quite as good as they normally are because of we're trying to limit our trips to the stores. And so eating the fresh things that we do, we may not be doing as much. And then of course, allergy is driven by environmental conditions. And look what we've had. We've had periods of rain followed by periods of gorgeous sunny days like it happens to be today. And what does that mean? It means things are blooming and the allergy, producing pollens are in the air. There's dust, there's mold. When the wind blows from the desert, we have that. So environmental stuff, allergies and dry eye are in full bloom in this springtime.
Right. Now, you mentioned that coronavirus ocular symptoms. Are you referring to the things we just mentioned, or there are some specific things?
There are some specific things. So the coronavirus is a virus like a common cold virus, but this one particularly targets the respiratory system.
Right.
What makes it unique is, like many viruses, it can affect the eye. It can actually cause a pink eye, a viral conjunctivitis. This is important because we've had a number of patients who've read about this and are fearful when their eyes are irritated or sensitive that they have coronavirus, when in fact they have common allergies or dry eye problems. Mm-hmm. And so I have a picture of coronavirus. And what you'll see in a typical viral pink eye is a very red eye. The eye looks beet red. The blood vessels are really swollen in a way that you wouldn't mistake for being something minor. Often there's an accompanying interesting symptom you can help diagnose yourself by feeling. Right in front of the ear, we've got a lymph node that normally you won't feel it at all. Right in front of your ear, so like right from the ear canal, straight in front of that, in that area, if you feel along the side, sort of where your sideburn would be if you're a gentleman, you can feel a swollen lymph node that is often a little tender if you're having a viral infection around your eyes. You won't get that with allergies. You won't get that with dry eye symptoms. That's a very specific way you can diagnose yourself if you have a viral pink eye. If you're concerned about what's causing uncomfortable eyes, we're happy to do virtual telehealth visits just like this. Okay. And our office is available to do that any day. And so we're happy to do that. And you can do it right from the comfort of your home. You don't need a special software. It is helpful to have a phone, any type of smartphone, Android or otherwise, with a camera on it. But most of our viewers have that. And we can do a pretty good job diagnosing these kinds of things.
Now, we were talking to some other doctors earlier, and they're talking a lot about the teleconferencing now that's sort of coming out of all of this, and it's really been quite popular, as you know. Obviously, we're doing it here. But how do people know that, like, if they visit you, is it an insurance thing, or how does that work?
Well, thankfully, the federal government got right on this. And so they put in place some rules that allow you to use your insurance for a video conference with your doctor, just like you would if you're coming into the office. And so, it's as easy as that. We don't want anybody to get surprises on the cost of visits. But now your insurance, whether it's Medicare, whether you have a supplemental, basically we have, they put in place some codes that can be used to bill them for your services. So if you call or you email appointments@harvardeye.com, works for, by email, or the phone number is 949-951-2020. Either way you contact us, you can talk with the staff about how that works.
Okay, great. And then one last thing, I did want to talk about the pink eye, because pink eye, it isn't just a coronavirus thing. It can be a variety of things. How do you get it?
Well, pink eye is, you get it just like you get the common cold. And the most common way is what we're learning through our hands. Washing our hands is what prevents it. Thankfully, a lot fewer people have common colds right now because of all the hand washing we're doing. All the social distancing helps with other less lethal viruses. So if you have, upper respiratory cold, cough type symptoms, and you have a red eye, whether it's coronavirus or another one, probably you have pink eye. But we can help diagnose that even with telemedicine. And I have, just for contrast, I brought a picture, I shared a picture with you of what more allergy looks like. The most common type of allergy we're seeing is on the eyelids. It's almost like eczema on the skin. You'll see around the eye, the eyeball itself is not that red, but on the skin around the eye, there's a roughening that looks almost like alligator or snake skin that is kind of telltale that allergy is playing a role. And of course, the thing about allergies is itching is a prominent symptom. If it itches, it's probably allergy and not an infection.
Now, are you able to diagnose, obviously you can diagnose the problem technically over the teleconferencing. What about a prescription? Can you still get them a prescription?
You bet. Yep. And that's exactly what we need to do. And of course, most pharmacies are delivering now, so you don't have to leave home. and I believe many of them are doing it at no cost, although obviously call your pharmacy. We always try to prescribe less expensive medications. There are some over-the-counters as well you can order for delivery where that's possible.
Okay.
Yeah.
Good. Well, thank you so much for the information. I appreciate it. Hopefully we'll be done with this stay-at-home thing and they'll start letting people come out and do their thing.
Lisa, it's a challenging time for everybody. Keep a positive attitude. That's really important. Get up, move around, and try to be as normal as you can is my best advice just as a doctor, because we'll get through this, and on the other side we're going to have probably some newer, better habits for taking care of ourselves if we do the right things. So thank you, Lisa. You've been working especially hard these weeks to keep the community informed. Everybody really owes you and the whole crew there at the TV station at Channel 6 a thanks for being there for your community. I'm grateful, and it's a pleasure as always to work with you. So.
All right. Well, thank you so much. You stay healthy out there.
Thanks, you too.
All right. Thank you. And we'll be right back after this.
We hope you enjoyed this special edition of Your Health. We hope to be back in the studio soon, so stay tuned and join us next time as we learn more about your health.